Welcome to The Breakdown with Dr. Earl, a mental health podcast. This is Dr. Earl Turner, a licensed psychologist and psychology professor in Los Angeles. Just a few disclaimers. The Breakdown podcast is not intended to replace working with a licensed mental health professional. Welcome to The Breakdown. This is Dr. Earl. Thank you for joining me today for another episode of The Breakdown with Dr. Earl. On today's episode, we are talking about finding a Black therapist, and I am excited to have Dr. Joy Harden-Bradford join us today. Dr. Joy Harden-Bradford is a psychologist in the Atlanta, Georgia area. She's a speaker and host of the podcast Therapy for Black Girls. She's also been featured in the Oprah magazine, Forbes, MTV, Essence, and more. So thank you for joining me today, Dr. Joy.
Thank you so much for having me, Dr. Earl. Always a pleasure.
Yeah, so we've known each other for a while, and actually, ironically, we were both quoted in this article in Oprah magazine a couple of years ago.
Right.
I don't think we knew each other at that time.
We didn't.
Or of each other's work, but we've sort of crossed paths in the last couple of years at conferences and stuff. And so it's been great to connect with you and learn about your work and the things that you're doing. And I'm really excited about this conversation and really diving into the challenges that people have with finding a Black therapist, or even a therapist that is culturally competent in terms of the language that we use. So
yes.
Before we sort of dive into all of that, just tell the audience that may not be familiar with your work, just a little bit about yourself.
Yeah, so Therapy for Black Girls was started in 2014 as a way to make mental health topics more relevant and accessible for Black women and girls. And I really started it after watching the Black Girls Rock award show on BET. So the energy just even through the screen was just palpable. And I thought, wow, wouldn't it be cool if I could create something that captured this same kind of energy for Black women related to mental health? And so the site started with me making blog posts about different topics, and then in 2017, I added the podcast after falling in love with the medium of podcasts myself. Thought that would be a way to add some additional content for people to chat about, and also added the therapist directory. And so it has now just blossomed into this amazing community of Black women across the world, talking about mental health, supporting one another, and really just, helping each other prioritize their mental health.
Great, yeah, and that was a nice sort of introduction into what I really wanted to talk with you about, is just some of the challenges of finding Black therapists specifically. And I know that your platform is geared towards women and girls, and for my podcast, we oftentimes focus on issues specifically to Black boys and men, and obviously some of the episodes have been more broad. But I think some of the similar challenges occur for Black men as well. And I actually just got a referral today looking for a Black male therapist or a counselor in the Texas area. And I was like, I can recommend some people, but I think, as we know from the field, that one, diversity is very limited. So I think the last data that I came across maybe about 2 years ago from the American Psychological Association noted that about 85 to 90% of psychologists, and obviously that the numbers are different at the master's level, but about 90% of psychologists are white. And so that makes it a very difficult task for people that are Black and brown to find therapists that look like them. And so I think your directory is really a great resource. And I've seen a number of other platforms that have talked about therapist directories for like Latinx or Latino populations, and also for Black men as well. And so I'm curious about, as you begin to create this directory and think about connecting people with providers of color, what was some of your decision making around how useful this could be?
Yeah, so hindsight really is 2020, Dr. Earl, because I started the directory just because I continue to see conversations online from Black women saying, hey, I would really love a Black woman therapist, or does anybody know a Black woman therapist in this area, or whatever. And so it felt like, wow, wouldn't it be cool to have a place where people could find these people that they're looking for.
Right.
And so I started it just as a Google Doc, thinking like, maybe some people would use it and it would be helpful to, some people, and didn't at all imagine like what it would become. So like I said, I started it as a Google Doc, and that quickly became something that was like um that I wasn't able to manage by myself anymore. So
Right.
then I had to invest. Like clearly it was a need, and so then that meant me investing to turn the directory into something that people could add themselves to, that was much more sustainable without me necessarily being involved. So when I started it, I didn't at all imagine what it would become. So I think at the end, I put the call out like, hey, if you have a great Black woman therapist, send it in, I'll compile it. I put that out at the end of December 2016. And I think at the end of that month, I had 90 therapists. And
Wow.
now there are over 1,600 therapists in the directory. So it really just blossomed and took off. But I think really speaks to the need, like you mentioned earlier, that people are looking for therapists who they feel like will get who they are, and that there won't have to be a lot of explaining related to some kinds of concerns.
Yeah, and I think, I just published my first book last September, and one of the things that I talked about in it is that for Black clients specifically, that, sometimes they prefer a therapist that is non-Black,
Hmm.
but a lot of times they prefer someone that looks like them, a Black therapist. And I think part of the decision making, as you just sort of mentioned, is this person sort of gets who I am and knows my story, and that I don't have to provide a lot of like education to them about my culture. And obviously, when we talk about this as clinicians and people that sometimes do trainings around this, that you're not going to know everything about every group, obviously. And
Right.
I think that's one of the reasons we try to move away from this concept about like cultural competence, because how
Mhm.
competent can you be in understanding someone's
Right.
life story and culture? But I think that that's a valid point. And when it comes to making that connection for people that they don't want to go to therapy to like get help, but also have to like explain what it means to be Black. And so I think
Right.
that's a really huge benefit of having these directories, like, the directory that you created, to really provide
Mhm.
the resource to make those connections for people.
Yeah. Yeah, Dr. Earl, I think, and I'm sure we will get more into this, but the fact that in our histories and in our families, typically there are not a ton of people who have gone to therapy, right? And so for a lot of us, we might be the first one taking this step. And so I think when you're approaching anything that is foreign, that feels unfamiliar, you're looking for some familiarity. And so even if you don't necessarily end up working with a Black therapist, I think that for a lot of Black clients, they are looking for that, especially if they don't have a previous framework for therapy. They want to at least be in a situation that may feel a little familiar to them.
Mhm. Yeah, and I think that may be part of why for some Black clients that they prefer a Black therapist, is that
Hmm.
like comfort of like easing into that relationship when you may not be familiar of what therapy is like, and so that
Right.
may like ease that transition for them. So I think that's a
Yeah.
really great point that you brought up.
Hmm.
But one question that I'm curious about is from your own experience with either just like creating the directory or talking with people about finding a therapist. What are some suggestions that you might have in terms of, if there isn't a Black therapist in your
Hmm.
community?
Hmm. Yeah, so I think that you can ask very directly, like, how many other Black clients have you worked with, right? So I don't think that that's an offensive question to ask. I think if we were asking about, like, how many anxiety disorders, have you treated in people, we wouldn't see that as off base, right? But for some reason, when we talk about race and culture, it feels like, oh, that is a big thing. But I think it's perfectly acceptable to ask, like, how comfortable are you working with Black clients? Have you worked with Black clients before? How much work have you done in terms of unpacking your own privilege and how that comes into the therapy room? So I think that all of those kinds of questions are perfectly acceptable to ask either a black therapist or a non-Black therapist.
Yeah, and I'm glad you brought that part up, because I think the assumption sometimes is that if you are Black or from that community that you're working with, that you have the skills to do that
Mm-hmm.
from a clinical perspective. And so
Right.
I think that, it's also important for us to consider for Black, clients seeking therapy from Black clinicians, that you also may want to ask them about their experience and how that
Mm-hmm.
sort of fits with your needs as well. And
Yeah.
the other part that for me, like when I get referrals and I'm not seeing clients right now, but people still reach out to me through my website, is understanding like what are you specifically looking to get help for. And so I think that's
Mm-hmm.
another sort of concern or topic that comes up for me, in that for some people, and again, it may be related to them having limited experience with therapy, is that there isn't the assumption that people specialize in different types of issues. And so
Yes.
they are looking for, again, when it comes to like Black males, they're looking for a Black male therapist. And I always ask, well, what types of concerns are you, seeking
Right.
to get help with? And so I think that's the other piece that we need to do better about as a field, in terms of like
Mm-hmm.
communicating that people also have expertise or specialties in areas that may or may not fit what you're looking for, specifically when it comes to finding a Black therapist.
Right. Yeah, that is such a great point. And, whenever I talk with potential clients, either just in our therapy for Black girls community or when I do talks like this, I do stress the importance of making sure that the therapist, even if you are really, really searching for a Black therapist, you still want to make sure that that person has expertise in the area that you're struggling with, so people will like see me speak, and I, like you, also am not accepting any new clients, but they will hear me speak and think, oh, I would love to work with Dr. Joy. She'd be a great therapist for me. And while that is a compliment, there are some things that I am just not skilled in handling, right? And so I do think it's important that we, use the analogy of our colleagues in the medical field, that there are specializations that people, so you wouldn't necessarily go to a podiatrist if you're having issues with your heart, right? And so you want to think about therapy in those same ways, that we all have some general training, right? So transition kinds of stuff, normal kind of life stuff, most therapists can likely help you with. But if it's anything beyond that, then you do want to make sure that you're going to a therapist who has specialized training and does a lot of whatever it is that you're coming in for.
Right, and that's a great point, because like for me, my training is general, so I went to a general PhD program, but I
Mm-hmm.
specialize in working with children and families, but
Mm-hmm.
also from like the adult perspective, more specialized in things like anxiety, stress, and depression. And so like
Right.
for clients that may be looking for help with like substance use
Mm-hmm.
disorders, or things with more severe psychosis like schizophrenia, that's not my expertise. And so
Right.
I have to again like educate people and inform them about the importance of really making sure that you also ask those questions. And part of that
Mm-hmm.
for me sometimes is asking, what types of concerns are you looking to get help with in a
Right.
general manner, so that I can maybe guide them in the right
Right.
direction.
Mm-hmm.
And so so my first question is, how does this like racial climate and tension make it difficult to search for a therapist? And then how does that like impact that therapy relationship if you've already had an ongoing relationship with the therapist?
Mm-hmm.
Are you
Yeah,
just
those are great
great
questions.
question?
Those are great questions. So I think even more so now than before, Black clients are looking for Black therapists. And so we've already discussed the numbers, right? And so we are most familiar with psychologists because that's what we both are trained as. And I don't quite know the numbers on master's level clinicians, but I know that it still does not match. It's not like a majority Black therapist, even at the master's level.
Right.
And so the truth of the matter is that even if every Black person wants a Black therapist, there are not enough Black therapists to go around. But I think lots of people are looking right now. And again, we have been doing this work for some time, and so we know that there are microaggressions that occur even in the therapy office, right? We know that we have white colleagues who have not done the work that they need to do to actually appropriately take care of Black clients. And so I think Black clients are just not willing to take that risk right now. Kind of given the heightened level of everything, it just kind of feels like I'm not even going to try to maybe work with a white therapist because I don't feel like I can take that chance right now. And I don't think that people are all the way wrong in feeling that way in some cases. But I think what is also happening is clients who maybe have a non-Black therapist that they've been working with for some time now. I think people are probably looking at their therapist kind of side-eyed, like if your
Mm.
therapist has not said something, right? And again, I know that lots of our training talks about being a blank slate and you don't introduce anything into the therapy room before the client does. But I think particularly as it relates to race and culture, if you are not introducing those topics, then you're doing your clients a huge disservice, because we know that when we introduce things in the therapy office, we make it talkable, right? We make it so that the space feels like, oh, okay, she can go there with me, right? But
Mhm.
when we don't say anything about it, it feels like it has to be something secret or something that I need to be ashamed to talk about. And so I think we need to remember that we can trust our clients that if we bring something up that doesn't apply to them, that they will tell us, like, oh no, that's not an issue for me, right? But when you don't bring it up as a white therapist, then you're making it so that it feels like this is not something that can be talked about here, and I don't know if this is actually a safe space like I maybe thought it was. So I think what's happening is that Black therapists or Black clients are looking at their non-Black therapists, wondering, okay, is this space as safe as I thought it was if their therapist has not brought up something about it?
Yeah, and I think, that's something that I've been more adamant about discussing, specifically when I've done like workshops around cultural competence, is that as the therapist and clinician that, specifically, I think as a non-Black therapist and clinician, that it is it's your responsibility to like bring up
Mm-hmm.
issues around race and culture. And as you sort of stated, that if the client doesn't want to talk about it or it's not something that's relevant to them, they will let you know. But I
Yeah.
think part of building that trust in that relationship is that if you provide that space where you are talking about these issues, and at least bringing it up, then you make them feel like this is a comfortable space, that the therapist is aware of, like, I live in a society and context where
Yes.
like my race is important,
Mm-hmm.
and that they are more likely to